we're doing step-ups onto a 20 centimeter box. This is essentially a strengthening component for a patient with patellofemoral syndrome. And we've already discussed that if we incorporate a holistic approach where we strengthen the hip as well as muscles around the knee, that we see improved function and decreased pain. So here we're doing something that's going to initiate the hip and the quad. So essentially we gave him some dumbbells. We progressed. This is not 20 centimeters. This is more like 12 inches. But we've progressed at this point, so don't worry, everyone. He can do this. So essentially we're gonna alternate feet, but he's gonna go up with his right leg, and we are going to make sure that he is maintaining the patella or the knee behind the foot, so we don't have too much joint reaction force to the patella, which would increase pain. So we want to make sure that we keep that behind the toes, and then he's going to come forward, keeping the head and chest up, and he's going to power through using his quads and his glutes. So one thing I do want to add as an addition to this is that he can use a barbell rather than dumbbells that he put on his back, and I like this for this reason, because with dumbbells, a lot of people have a tendency to lean forward and give that bad posture because the weight's pulling them forward, so you really have to initiate that back. With somebody who's fresh and new and doesn't know how to do this, barbell's good because it promotes that that trunk extension. So Zach's doing a great job there. He's just going to do the same principle here. Zach's going to go talk about the parameters.
All right, so I, as a patient, am going to perform 3 to 12 sets of this. Initial load, we want to start about 10% of my body weight, and then as we begin to progress, we're just going to bump that up by 5%.